Okay, so last week we began maybe talking about corrective exercise and did not, but this week we will deep dive and we will discuss what it is, whether or not you should do it, and just what our experiences with it are. So I think the first thing that I wanted to start off with is not necessarily just an anecdote, but I think an insight that have gained through the experience of going through a lot of different kinds of corrective exercise, not really seeing a ton of great results, or if I did, they were sort of novel and temporary. And this is something that I mentioned to you a week or two ago, whenever it was. But um, I think we need to start by addressing the word corrective because the word corrective carries with it a number of different implications that I think people are not necessarily aware of that they're subscribing to or absorbing. I think it's very easy to buy into a narrative when you're not aware of the narrative to begin with. And the narrative to begin with corrective exercises, there's something, number one, that needs to be corrected. And number two, that if it needs to be corrected, we can identify what the correction needs to be and where it needs to be. And why it needs to be in those places and in those ways. And so just the term corrective and the phrase corrective exercise, it sort of operates off of a number of different assumptions that I think we need to kind of dispel or at least demystify, because there is this sort of weird energy when you initially get introduced to the idea of corrective exercise, which makes you think that the exercises that people do fall outside of this category that every other exercise is in, right? They fall outside of the category of like just being able to understand them via understanding basic physics and things like resistance direction, all the things we talk about in the context of, traditional resistance training. And so it's sort of looked at as this category that is like other. And, on the one hand, we can kind of do our corrective exercises so that we can supplement all the things that we're fucking up when we go into the weight room. And I think that, that is the kind of narrative that it's amazing to me how someone can absorb and subscribe to a story without realizing just how vast and um, sort of controlling the story can be to a particular person and the choices that they make. And that was a place that I was stuck in for a very, very, very long period of time, 3 or 4 years, where it was like I was constantly experiencing, tweaks in my pec when I was bench pressing, um, issues with my shoulder doing something as simple as a lateral raise, pain in my elbow doing skull crushers, right? Like all these things that I later learned were just maybe sort of physical mismatches in terms of like how my structure is interacting with, resistance. I sort of was problem solving for those exercises with other things that maybe temporarily made me feel better. And my perception at the time was, oh, if these things, these corrective exercises temporarily make me feel better so I can perform the weight room stuff, then they're sort of transiently correcting something about my structure, about my ability to contract, about, just my sensation overall. And, so in those moments, my perception was I am being fixed with these things over here, and then I am, damaging myself with these things over here. And I think that's what, really drove me in the direction to try to figure out more in the way of the traditional, what we call traditional resistance training stuff, is just the fact that I wasn't convinced that there was a problem with it to begin with in the first place. Like, so I was able to kind of go from this narrative where I was the problem to where no, instead I can just look at what I'm doing and see how it's interacting with me, and maybe adjust some of that stuff in the actual resistance training setting so that I don't have to do all these additional, things over here in this magical, mystical bucket. So interested to hear any thoughts that sort of come up for you around any of that stuff and just that general narrative. I know you have a good amount of experience in a couple of different, corrective exercise buckets. So I'm interested to just kind of hear about your experience with it and what your general thoughts are to begin with.
Yeah, when you said, I was kind of stuck in that narrative for a long, long time, and you said 3 to 4 years, I started counting up like, man, how many years like was I kind of in that narrative? And thankfully now, the next generation of trainers, educators, can move out of it maybe a little bit faster, right? But I think that was probably a good, decade of my life at least, right? I started training when I was 12, 13 years old. And, I started accumulating injuries not too long after, especially playing sports at the same time. And I think even before you get introduced to corrective exercise, um, there's also the paradigm of, I'm going to go to my doctor, I'm going to get a scan, and it's going to tell me what's broken. And then, if it stays broken, I'm going to go in and, get it surgically repaired. So sometimes for a lot of people, that I see off the street, sort of gen pop with an injury, like a lot of times that's their first go to, and maybe they see a trainer, and the trainer's like, don't worry about the imaging, don't see doctors. Doctors are bad. Like, I can fix you, with this bag of, corrective exercise tools that I have. So I think there's even a layer we forget about before that, and a layer that, I went down as well, because I mean, I had surgery on both shoulders by the time I was 17. Combination of football, rugby, weight room injuries. Um, and it's very common for that client to just say, like, I want to know what's wrong. Like, I want to see exactly like what's broken. Like, I need the images to tell me like what is the thing that's causing this pain. And they'll often ask you like, what exactly is this? Like, can you tell me what the point at something? And they'll go, tell me, what it is that hurts here. Tell me what it is that's wrong. Like, I'm going to go to the doctors, get a visual of it, and they can tell me then how to go about, correcting it from there. And, for all the things that our medical system's really good at, like say acute trauma, it doesn't tend to do a good job, with this type of patient who maybe just has like an overuse injury, let's say, that they're really just further instigating through their own behavior. And even worse than, maybe doing some exercises that give them, whether it be like an acute analgesic effect, or just move them away from the behaviors that they're currently doing towards other novel ones, uh, going in, and getting it worked on with, metal tools, maybe even has a greater cost. um, so there's that. So I went down that route as well. Then kind of found my way into the corrective exercise. And I think you see parallels too in like the functional medicine realm, where these two are kind of like, doctors have, failed me, and I'm going to look for something more, sort of non-traditional to solve my problems. And it gives you this sense of like agency as well, where you're not just like beholden to the medical system and getting a pill and, getting a surgical procedure, or the procedure, for example, that parallels in functional medicine could be like, you go in and, maybe you get like a instead of a look at your shoulder, like you get a colonoscopy or something, right? And you want to know like, my stomach hurts, and they go in, they get an endoscopy, colonoscopy, and they say like, everything's fine, you have IBS, diagnosis of exclusion, right? Or, you have shoulder impingement, you have hip impingement, right? And then from there, they, see 4 or 5 other people, they end up with this, functional medicine doctor, corrective exercise specialist, what have you. And then many times are just kind of, stuck in that system from there. Maybe and I'm not saying either one of those, like the physical therapist, doing the corrective exercise, or the functional medicine doctor, maybe doing like the GI tests. I'm not saying either one of those is bad and doesn't like 100% have its place, and that they couldn't employ the same sort of like, systematic approach that we'll talk about today. So it's not in any way like a besmirch of those. Like those are people that are really close friends of mine. Those are people I still talk to, get advice from. So it's not so much that, it's just within any field, whether we're talking about trainers, doctors, gut specialists, you, with the best intentions as a practitioner, you can get stuck in a paradigm that leaves people, sort of coming back to you constantly to get their dose of medicine when in fact you were trying to move people away from that in the first place. So it's a slightly different kind of medicine, but it still keeps people very much like trapped in this system of I do something and then I go to see someone, to fix it.
Hmm. Yeah. And I think so I'm kind of reminded in this whole conversation about the concept of posture and postural correction, because it falls into a very similar bucket, if not, you know, it might have been the thing to begin with, which sort of started this whole movement, which was, you had poor posture. Let me show you how to fix it, kind of a thing. And I think that, much like you said, there's a time and a place where it's like, okay, you know, put simply, if you're assuming one posture all, 80 to 90% of the time, if you're in this sort of like now demonized keyboard typing phone, neck looking down sort of a posture that everyone is so scared of now, if you do that 80 to 90% of the time, it's probably going to be helpful for you to do something that's not that, right? To go to the other end of the spectrum and to maybe do some extension based stuff to get your shoulders back, maybe to get your head back. And so people get a little sort of quick hit of that, the other side of the spectrum, and they feel better. Again, whether it's transient or maybe it lasts a few weeks or maybe it's the fix for them. And then all of a sudden to them, it's like that's the story that everyone should subscribe to in order to fix their issues, regardless of what their issues are. It's kind of that concept of like what you see is all there is, right? If you've had this experience, then why shouldn't other people also have this experience? And I think that when you see that in the context of like a paid product, right? Whether it's someone selling something online or physical therapy, that is sort of something that feeds more and more and more into the tribal thinking, because people have invested money in a particular direction and they don't want to feel like they've ever wasted their money, or they've put their money towards something that may just be a sort of false narrative to begin with. So the posture thing to me is, can't be simplified or reduced down to like, is this a good or bad posture? And I think that much in the same way, you can't necessarily from a super broad perspective say that corrective exercises are bad and that resistance training is good, but you also can't say the opposite, right? You can't say that you need corrective exercise because corrective exercise is good and it will correct whatever you're doing wrong because resistance training is somehow bad. And I think this is sort of like this becomes this positive feedback loop where, much like you're saying, you continue to rely on those, short-term, more novel solutions. And so you never actually address the thing that is potentially giving you problems or excessive amounts of stress in specific areas to begin with. So, the feedback loop for me was essentially I go and do a bench press. I progress really nicely for 6 to 8 weeks. 6 to 8 weeks comes around. Usually it was my right pec. Usually it was something in my right upper pec would go. And then I would be forced to take anywhere from 2 to 6 weeks off, all the while trying to figure out, oh, is it my serratus? Is it my middle traps? Is it my trap three? Do I need to be able to do this trap three raise with this amount of weight so that I can bench press? Right? You go down all these different rabbit holes in search of a potential solution that maybe in the first place was either to simply just manage your volume and your stress a little bit better on that particular thing, or maybe just to choose a different thing, to begin with. If you're sort of beating your, hand with a hammer, it's best to kind of maybe at least remove the hammer, or we'll say lessen the amount of times that you're hitting your hand, to begin with, maybe so it's more sustainable. And I think that I like an analogy for this, which I heard someone use the other day, which is with this kind of a thing, you're essentially trying to fit a queen-sized bed sheet onto a king-size bed. where it's like every time you sort of put one of the corners down, it's like you go to the next corner and maybe it's a little tight, but like it still gets on there. You go to the third corner and it's like the first corner pops off and then maybe the second corner pops off, right? So it's like the goalpost just kind of continues to move around and you're left with this really just shitty experience of running into problem, paying for solution and subscribing to it, running into problem, and it's just this circle. So I think that that was all mostly like a preface to maybe the actual more practical application side of this, which is, well, what can we do instead if we have gone down that rabbit hole to no avail in terms of like solutions. And so for me personally, there it wasn't like it was one thing. It was just like this long-term accumulation of just more and more information, more and more data for myself specifically. And that is interestingly what has, led me to do what I'm doing now. I think to begin with is just like the accumulation of and the search of trying to find solutions that were not these other things. So in some sense, I do have, corrective exercise to thank, because for me personally, again, I didn't have particularly good experience. Um, but now I'm in a position where I don't do anything outside of the gym specifically. I don't do any sort of manual therapy, physical therapy. Again, that doesn't mean that they don't have their place, but I do think that a vast majority of people are still subscribing to these modalities, not because they see some sort of real measurable benefit, but because it's something that they've either always done or they've always been told that they should do. And so I kind of want to take this now more toward like just reframing the conversation. And I'm interested in terms of your experience, how you sort of reframe that over time. And now you've arrived in a position which I do want to talk a little bit about sort of what the things that you currently do, that are not just resistance training itself. But over time, you've certainly gotten rid of a lot of things or sort of moved past a number of different things, manual therapy, those kinds of modalities. And you're now at a point where you're mostly just training focused. So I'm interested to hear what your transition was. And when you started, how did you sort of navigate the beginning of that phase of like moving maybe away from the rehabby stuff and more toward addressing, the X's and O's of training. You're still on mute.
So, I think this conversation really lends well, like many to people who are similar to ourselves. It's like maybe on one end of the spectrum, you have like a professional basketball player and they're playing X amount of games per year. They maybe have multiple games in a week. They're, 7 foot tall, running on a hard court, and they're trying to survive behavior that is knowingly, coming with consequences that they're simply like not thinking of as like an adaptive process, but more as something that they just need to be able to repeat time and time again. And moving down that spectrum, maybe you have a power lifter where it's like, yeah, there are some very specific things that they need to do, but at the same time, like they have some options in terms of like how they achieve that. Like, yeah, on the court, you can probably manage playing time, to a degree. Um, there are, and this isn't, obviously our specific field, but there are less things in terms of, what you have options for in regards to like if you have to go out and, pitch over and over again, you have to go out and, play a game of basketball, hockey, etc., than if you're just trying to get jacked, So
Mhm.
like this nature of specificity and even moving further down that rung, a lot of the people that we see in the general population or that some of the trainers listening to this see in the general population, move even further down that rung of specificity. And I think a lot of our experience in terms of people who are like really spinning their wheels in this department live, somewhat close to where we are and are probably, the audience listening to this podcast where they're either someone, who works with clients and is, spent a good amount of time like, studying this realm, or they're someone, who has aspirations themselves of, being, more muscular than the average person seeks to be, or stronger than the average person seeks to be. So they're not all the way on the spectrum of like, playing multiple, professional, sports games every week. And they're not someone who's just trying to like, make it to their 80s, 90s, like in a healthy way. Um, and with that population, a lot of them have, traveled a similar route to what I have, or, they were maybe headed in that direction because, they may have not been doing this yet for 20 years. But for me, moving from that kid I had mentioned in the beginning, who, got the shoulder surgeries, was looking at like, okay, what does the MRI say? How can medicine fix this so that I can, clear the slate? It's like, oh, if I get these surgeries, then, I'll start from, floor zero again, and I'll take the elevator back up. Uh, of course, my story is as soon as I did that, after, a year of basically getting back to my previous performance, I had the most catastrophic shoulder injury to date, and I was right back where I started again. And I think that is, more or less what took me from like the physical therapy realm where you get the surgery, they prescribe physical therapy, you go there, you get the stick, to stretch out your range of motion, and you get the other stick that you like shake, and it's kind of like, I don't even know what it's called, but there's this sort of bendy stick that you shake, and it's supposed to like activate your, rotator cuff muscles, and you get a little bit of ultrasound, you get a little bit of IR, and you know rest, ice, etc. Going through that whole process was kind of my introduction to physical therapy, of just like, here's your script, go here, get your range of motion back. And I think, post surgery, for the average person, maybe they have a knee replacement, hip replacement, etc. If they skipped that altogether, it'd probably be bad news in terms of function. Like if they just, did nothing. So the average person just, regaining some motion, regaining some, strength, just kind of like keeping those joints moving to some degree after serious surgery, sure has its place. But moving from there, now I was in school for exercise science, and I was being exposed to kind of the paradigms at the time of like the, let's see, early, 2010s. So this was kind of like functional movement screen territory. Was learning this stuff in school, but then also, on the weekends, going to seminars and whatnot, just trying to expand my knowledge. So the initial sort of like entrance into this was, you get a movement screen, and it basically tells you like what you're deficient. And if you can correct those deficiencies, then you're going to be bulletproof. So it's like, started with, all right, you get the surgeries, and, and everything's fixed. You're back at ground zero. You're good to go. Next one was like, you do your functional movement screen, you find out what's broken, you correct those things, you're back at ground zero, you're good to go. So I think, that mentality, was pretty pervasive, not just with the functional movement screen, but then moving to, other schools of thought, where it still came back to that same basic concept of, we're going to take some measurements, and we're going to see where you're lacking relative to some like, assumed baseline, irrespective of the person in front of you. So instead of kind of a conversation about, exactly who you are, how you got there, like what are the major sources of, physical and even systemic stress that sort of took you to this point. It's, yeah, we'll have conversation for a few minutes, much better than anything I would have gotten in the like post-surgery rehab realm, where it's like, you're going to see probably not even, maybe you see the PT for a second, they pass you off to an assistant. You have a sheet, of exercises that they printed out, and mostly just doing that, on your own with, either no one observing or someone, who isn't, specifically trained in that, helping you. So at least in this realm, it's a little more personal. Someone has their hands on you, they get to know you a little bit, they're testing your ranges of motion. Sometimes that's, passively on the table, sometimes that's standing, looking at tests like, squatting, lunging, in various things that are either assessing like, a passive or quote active range of motion. And but that same concept was still really pervasive in terms of like, you're lacking something here. You should have this. If you have this, then you will be more resilient to whatever stress you want to impose upon yourself, which is a very like enticing narrative, right? That like you can just do these things that will kind of bulletproof you, to life. But really, at no point was there like an examination of, well, what are the main things that are bringing you here? It's just kind of like, well, we know what you're doing, is really taxing on your body. We know that maybe it's not like, as healthy as just like, training for health and function and being functional or whatever, catchwords you want to use there. You're doing something that's less than ideal. So to your point earlier, and I thought you did a really good job of kind of describing that whole narrative, which is that like, um, we are kind of buttressing against, the things that you're doing that, aren't necessarily ideal for human function. But, if we can set you up in a good position, joint wise to do so with these exercises, that at least you'll be a little bit more, resilient to it. And I think really the breaking point for me, like when it all came together, is when I got to an impasse, with my back. And at that point, I had actually moved beyond like doing, the corrective exercises, because when I would go to these courses, like I would dive deep into it. I would just do the exercises multiple times a day, maybe 30 minutes, before training. Um, and I got to the point where it was like, okay, these aren't really doing the trick anymore. And then the narrative kind of became, well, you're just so big and strong that these just aren't like potent enough. So we're going to play pickup a different way, which is like, we're just going to use, manual therapy to try to like keep you together. So, I would have a couple different manual therapists, and each week I would see, kind of alternate between the two. And that was at least, another couple years. Like even during that corrective exercise period, there was still manual therapy interventions. Like if something, acutely was hurt, I would go, see the PT. We do some manual therapy. I'd get a new series of exercises, to fix this, this new problem, and then that cycle would just kind of repeat itself. So when I got to the point where I just clearly like, wasn't able to keep up, in terms of like the pain, wasn't going away. And, I didn't really have any more, cards to pull from that realm. That's, when I met Stuart McGill. And, our initial assessment was 4 hours, which you were there for. You know, really got to know, a bit about, my story, and a lot of it, was just conversation, in terms of just understanding like, where I was coming from, what my pain triggers were. And you know very simply, he just recommended like, look, and it helps when someone is seen as like, this is the guy. Like you're at your end, you've tried everyone else, and you have that respect coming in of like, this person has worked with, athletes X, Y, and Z. What he says goes. So he's like, look, I need you to take at least, I think it was, 3 weeks off or whatever, 2, 3 weeks off. Like we're just going to take time completely off of training. We're going to start working on, your behaviors outside of the gym. As I was just reading through his books, going through his courses, a lot of it came down to just, managing, total training load, or even kind of like, physiological load or allostalic load, like, throughout the week. So that might be, just frequent walks. That might be how you pick things up, how you sit, but also just like looking at your training through the perspective of like, if you're hurt, it's because of you know it's because of your behaviors, not necessarily because of something that you lack. And then if we fix those things, you can sort of bulletproof yourself. The idea is like, you are where you are now. Let's work with what you have, and let's start to slowly build tolerance over time. But we're going to need to understand like, what are those things that are picking the scab, as you alluded to earlier. If you're hitting your hand with a hammer, let's remove the hammer. And then once we do that, we can start to see like what those hammers are. And if so we journal on it. And, I got to the point now where like, it's not that I will never, have a day where I wake up and it's like, oh, something feels, a little bit funky, but I'll realize I'm never, in pain, at this point. Not that, it could never happen again, but just that I'm able to pick up on the signs and symptoms much earlier. And it's very easy for me to identify, oh, I made this change to my program. I added this exercise, added a little bit of volume. And at least I can start to build a hypothesis around like, maybe I'm going to modulate my training volume. Maybe I'm going to tweak this exercise. Um, and start to, again, that word agency of like, feel like I'm the one who's in control here, and I have at least a reasonable hypothesis about what may have taken me to where I am.
Yeah, so a couple of things I wrote down there just to go back to some of them, some things that came up for me. The first was on just manual therapy. So I'm not someone who's in a position of authority in relationship to, these kinds of things. I'm not super familiar with research around manual therapy. Some people say that, oh, there's clearly no data to support cupping and to support massage gunning and to support foam rolling. And it's like, well, we know that's kind of, one variable or one factor of many to consider. So I won't say anything conclusively or with certainty here, but something that I do want to propose that people maybe think about when it comes to manual therapy is, and manual therapy, massage therapy, I'm kind of using them interchangeably here, is if you have an issue, let's say like you wake up with some neck tightness or whatever, and you're like, oh, my neck hurts, my neck is bothering me, I should just go get some manual therapy today, so that I can at least sort of, feel better and at least function normally. And maybe as a consequence of that, I can do stuff, right? Like I can actually be a person. That it sounds at surface level like a harmless narrative, like, oh, if it helps the person, it helps. That's the kind of what people say. If it helps, it helps. And I'm not so sure, right? Because it's kind of like, if you run into that issue to begin with, if you have the neck pain, if you have whatever, name the pain, and you go to remove the pain via just a whole uh influx of sensation, right? Whatever the mechanism happens to be there. Um, what you're doing is you're sort of eroding your body's response to whatever stimulus that you're being given, right? So you're sort of in essence creating potentially a lot more noise than signal, where maybe when you were feeling that pain, you woke up with that discomfort, that was the signal for you to be like, let me pull my foot off the gas and just try to like relax today, rather than going to this person who's going to sort of beat me in a very particular way so that I don't feel this thing anymore, right? So it's almost like, is it something that is good because it feels good? I don't think in absolute, obviously not. I think that there are obviously levels to this, and where you sit along a spectrum of magnitude matters. But just, to maybe provide a different insight to what people are used to hearing, that's kind of what comes to mind with manual therapy. Because you and I have a mutual friend who like did manual therapy for years and years and years with his neck. And it was like, of course, there are confounders, but the second that he stopped doing manual therapy, it's like he just never had a neck issue again. Right. So again, that's not to say the manual therapy was the cause of, but maybe there was something there in terms of what I was describing about noise and signal that was interfering with his ability to actually maybe get to a better place. So just a potential thing if any people are stuck in this loop to consider. Another thing I wanted to talk about was just your diagnosis, because man, when I like originally saw the scans that you had done, like on your lumbar spine and your sacrum, I mean, that thing was like, I'm pretty good with reading, research and like dense textbooks at this point with, just general anatomy based stuff. But that was like, not only was it another language, but every term was like 3 syllables at minimum. And it was just like 5 paragraphs of diagnosis. And I remember my friend at the time, I remember showing him, he's a chiropractor, who's not your traditional sort of chiropractor. And he looked at it, and the first thing he said was like, "Oh God, like you can just ignore most of that," which I thought was which I thought was interesting, maybe a bit extreme. But this is someone who has seen this kind of stuff a million times, who has worked through the process of, like you were describing with Stu, just meeting people where they're at and sort of, not labeling people as their diagnosis. So I think that's another important message to take away, which is like, you didn't sort of just subscribe to the narrative that this is the diagnosis and therefore I will be constrained to these things. We went out sort of searching for different solutions because of the fact that, we didn't buy into that idea of this is, Ethan is this diagnosis. And I think that's much more empowering than people maybe realize if they've never encountered that situation. Um, and then, I think what we're ultimately talking about with, a lot of these corrective interventions and the narratives around them is this idea that there exist these black and white solutions, and these black and white solutions are just sort of floating around and just waiting for you to encounter them. And one of the things that you just mentioned was like, I mean, and we were talking before the call about just the various signs of fatigue that you're observing. And I think in relationship to your back specifically, the thing that I think about the most is just like how much you focused on changing your habits day to day in terms of the structure of your day, and how you sit and for how long you sit and how you get into the car and how you walk up the stairs and how you tie your shoes. And people think that that stuff is like overly overly maybe myopic and almost too nuanced to the degree that it's like silly. But I actually think that those behavioral changes are the things that over time have ended up giving you the highest sort of return on investment in terms of just, obviously the training stuff is super important, but people, when they are tied to the the solution corrective exercises out there mindset, they actually, I think most of the time, ignore the obvious behaviors that may be magnifying those problems over time. So, a couple examples that I just listed was just like the way that you're sitting or how long you sit in a particular position. Like, I'm not someone who experiences really back pain ever now. But I am mindful that if I'm working on something at my desk for 8 hours, I'm going to alternate between sitting and standing, right? Because I have a standing desk. And so just those kinds of solutions are really, to me, like, I almost look at it as like skill acquisition and skill development of like being able to actually pay attention to what you're feeling and actually being able to, um, be a little bit more objective about like, okay, what kinds of behaviors over time seem to be contributing to this thing that's not so good. And what kinds of behaviors seem to be contributing in the other direction, in the positive direction. And when you have that solution focused, corrective exercise focused mindset, you neglect the skill development aspect of this equation because you assume that you're going to just designate this time period to this thing, and at all of the points you can sort of just ignore, the other variables that may be important. So it almost like allows people not to pay attention. It allows people to be more mindless about their day to day, which initially there is, I admit, a lot of sort of reprogramming that you probably have to do. But it's certainly is the highest, I think, yielding, strategy in terms of its a return on investment. So I had one more specific question for you, but did you want to just along all that shit that I just said, did you have anything that was interesting to you that came up, or should I move on?
Well, I finished with talking about Stu, but there were also some other parallel tracks that were happening in the background. And it was like maybe I had started them a few years before, maybe even there were just like sprinklings of it, 6, 7 years before, but they all kind of like coalesced at the same point when I was working with Stu, because also I had taken some time off of training, which just freed up energy, to sort of focus on other things. So as you had mentioned, this ability to read your body or get like interoceptive feedback. I think that's something, as an athlete that, sometimes you can detrain, especially as like a strength sport athlete, where it's like anything from just over consuming to under consuming food, where you just have to get used to being very uncomfortable there, or just, pushing, fatigue, whether that be acutely, like in a hard set to failure, or whether that be, chronically, like, in a contest prep where you're losing sleep. And like I said, you're dieting, and you're also, kind of right on that verge of just overreaching from a training perspective. You get very good at just like detuning that, response to discomfort, which I think, can be very valuable. A lot of the people, that I work with are on the other end of the spectrum. But for me, working with a physical therapist who sees many people with chronic pain, and I had went to him because I was dealing with some symptoms, or basically like I would wake up in the morning, for years and years, and I would just be sick and vomiting, and I didn't know where that was coming from. And I looked for all sorts of just like measurable reasons, again, where that might be coming from. So seeing, all sorts of different practitioners, who could measure something and tell me like, oh, we're missing, this thing. um, and more or less, what that led to was just better, better self-regulation, better stress management, so to speak, being able to sense sort of when I was getting to a point of being overstressed. Again, managing my day was just huge. Managing my week, it's stuff that, Stu was sort of subtly hinting at in his writings, but was much more direct in working with Seth Oberst is the guy's name. Um, being able to pick up on those signs, being able to, again, like the desire to lay out your day and your week in a way that gives you rest is something for someone who's, very driven, not intuitive, right? So it's much harder in the beginning to say like, oh, I feel like I could use a little bit of rest. Like, the tough guy doesn't want to do that. Where it's like, no, I think I got this. I think I got this. And then like eventually you don't got it. Uh, Versus just like, it's subtle, because it's like I could be wrong. Maybe I could do more, but you break enough times, and you get in with the right people, and get lucky enough to have the right experiences that kind of teach you like it's better to take a step back even if you're wrong, than taking 5 steps back, um, when you've just let it go too far. So that was a huge part of the experience, as well as not only like much like corrective exercise, like in the beginning, part of the process was doing exercises to sort of, get in touch with that interoceptive feedback. There were exercises to help with my sleep, sleep apnea in terms of breathing at night. So, the goals were really just like improve, really like airway restriction, specifically, at night while I'm sleeping. And then, of course, better sleep leads to better recovery, leads to better self-regulation, leads to better decision making. Being able to, to read my body better, being able to just, not go through the conscious decision making process, but also more of the subtle, you know, feelings and subjective process of just like, hey, here's what I think's happening based on, the most intelligent thing that exists, like, the information coming out of our body, more so than any HRV device we can use, more so than, anything we could possibly track in a spreadsheet. So being that kind of person naturally, picking up these other skills of, using this incredibly advanced piece of, technology that lives inside of our body is telling us what's going on was huge. um, and those exercises of improving airway function in terms of like sort of managing vagal tone and just increasing parasympathetic activity throughout the day, those very much, to his credit and my credit, have really like segued more into just lifestyle stuff. So I don't really do many of those exercises per se anymore. Same thing with Stu. It was like we had some stuff that he taught me early on, some strategies to use. Maybe these are some things that you do, twice a day, some things you do before exercise. And there's, I still do his like big three exercises. The bird dog, side plank, curl up, before training. Seems to, add a little bit of just resilience to being bent in those directions and a little bit of sort of quote unquote stiffness going into training, when specifically part of the diagnosis was just instability in terms of just having little micro movements that would cause sharp pains. It seems like if you can do some exercises that maybe are not high in terms of just like the cost, like we'll call it like in this case, the compressive load that they're having on the spine, but maybe just add a little bit of stiffness going into an activity, where you might, where a high degree of stiffness might be required, whether it's, a neurological thing, a sort of like just a teaching practice, whatever it is, it seems like performance, and resiliency maybe improved slightly with that. And I think part of my bias too is like, if everything that I did with him, worked really well, and he says, he's had all his athletes do this, and that I should continue to do it as well. I'm like, yeah, for 5 minutes that it takes me before training, I don't feel like I should experiment with stopping it. But
Hmm.
other than those 5 minutes, and right now, as far as Seth goes, there's no real exercises that I'm doing on a daily basis, but more so I might recognize like, oh, today's a good day for a day off, or this is a good week, to have a deload. Or like, oh, I can hear these sort of like thoughts swirling in my head. Let's, maybe just go for a walk or put on some music. Like instead of just trying to continue to push it and continue to work, it's more so just like those strategies of daily living for the back. It's the same thing as far as just regulating, overall stress, where you kind of pick up on like, oh, I'm a little too wound up. I'm just going to bring that back down. And then the third parallel path was, I think really probably started just like meeting the guys. It was MI40 and then it became N1. So like Cassim and those folks kind of introduced me to the idea of like, um, modifying resistance training in a way that was a little bit more, targeted. And, we could look at it as like, let's just say more systematic, in a way. It just introduced me to the idea of like, maybe we can do more with resistance exercise, than, just kind of like what people are traditionally doing. We'll put it that way. And then from there, like, you were going down that path when I met you. So we started exploring that stuff together. We eventually met Tom. And I think, all three of those things, like working with Stu, working with Seth on the self-regulation piece, and then you and I, pursuing, the resistance training piece, like have just all been huge, huge factors. I don't think without any one of those pieces, I definitely wouldn't be where I am today. And I mean, man, especially the resistance training piece, because that's like, ultimately the biggest stressor that I impose on myself. Maybe just being near 300 pounds, but also like the multiple hours of training that I'm doing every day. If I'm not specific about how I set up and execute those exercises, that seems to be, probably like I said, you can't take away any of those other pieces, but being able to have the decision making process, to modify the thing that is ultimately the biggest stressor, orthopedic stressor in my life. I think that is, a huge piece of this pie. So that, those three things have really taken the place of, quote unquote corrective exercise for me. But I think our piece that, we're probably going to talk the most about is that resistance training piece. And that, has really taken me from, needing physical therapy to I haven't been for, multiple years.
Mhm. Yeah, that's really well said. And the question I was going to ask you actually was specifically in relationship to um, the big three stuff that you now do, because I think that it's very important that people have context around that. Uh, because I think a lot of people don't have any sort of experience that is similar to yours in relationship to the back pain stuff, and just throw the big three into the beginning of their training for no reason whatsoever. And so I think um it's important to distinguish between the context of your specific situation and where you've come from and where you are now and how it applies to your training, and just the sort of arbitrary use of something, an exercise that is well known, because as you well know, what just watching people do bird dogs, for example, in the general population, or even in just other trainers applying it to their clients, it's like it's not the same exercise, pretty, looking at watching you do it versus watching most of the people that I see doing it. So I think it's important. And that sort of, by the way, that discrepancy between how you do it and how someone who maybe doesn't understand what it's for to begin with, or what function it serves, that sort of, to me, it illustrates the difference in the context here, which is, are you doing this for a very calculated reason that is specific to your needs? Or are you doing this thing because you are watching the big dude over there do it? And the outcome of those two things ends up being almost opposite in terms of the way that people end up executing it. So that was good that you um, addressed that. The other thing I wanted to say was 100% good that you mentioned CASM, because for all of the things that I think people, just to sort of say it outright, people look at the stuff that I talk about and look at the stuff that CASM talks about, and they assume that, like, for some reason we're enemies that are like out to get each other. And like, it's weird, like people will just DM me and they'll be like, what do you think about this thing that CASM said, which is sort of like a leading say something bad about Cassim thing. But Cassim was the first person to like wake me up to this corrective exercise loop. Like, he was the first person to be like, Ben, what you're doing is stupid and you should try this other thing. And that, of course, was perhaps not the best way to message, and perhaps not the best way to get me to do it. But I eventually did. And it was like something that totally changed, the trajectory of where I took things here. So I'm super grateful to that. And I'm also super grateful, to Tom and all the stuff that we've done with him and in relationship to him, and sort of that combination of just the different kinds of exploration and how that has sort of worked in this cool synergistic way, I think has played a big role in where, like, as you said, both you and I have ended up. So I think, all that has been, and it is worth giving credit to. Um, so yeah, so the maybe just a final thing to sort of wrap things up, to give the most, and if you have anything to add to this after too, feel free to give the most recent and most practically relevant concrete example of this, where maybe in a previous version of Ben, I would have gone some corrective exercise route. For the last like 3 months, 2 or 3 months, I had this neck pain that I'd never had. it was very weird. It was very unpredictable, where if anyone can picture, where sort of your levator and your the lateral portion of your upper trap sort of runs into up into your occiput, just on the right side, what would happen is that just at a random point throughout the day, my right, that sort of space behind my right posterior neck would just seize up, would just like cramp, would feel like there would be like some kind of sharp stabbing sensation. And what would happen is I would get some sort of like radiating feeling and sort of like dispersion of that into my head. And it ended up feeling like a very nervy pinch, like I was getting like a nerve shock from it. And this would just happen unpredictably, with seemingly no pattern. And so I think in a previous version, of me, what I would have done is I would have said, okay, like what exercises can I do, to address that area? What things, maybe I'm breathing incorrectly, maybe my posture is bad, maybe I'm spending too much time in this position, right? But what I did was I just looked at, okay, like what are the sort of really big movers here? And what are the things that have maybe changed in the last couple months that may have had some kind of impact on this? And there were two major things. The first thing was I introduced a couple of different variations that were more like you'd be familiar with, like the shrug row type of thing. Um, but I had always done like sort of low to high stuff in relationship to training those tissues. So I wasn't like too convinced that that really played a role, but that was something that popped up. But the bigger thing that ended up, I think, making, it's tough to say and tough to make these connections, but in my estimation, this was the thing. I was like, what else in my just daily routine or daily life changed? And I had almost around the exact same time I had started experiencing the pain. When I look back, I had changed my pillow. And so what I did like 2 weeks ago, I switched my pillow back. And a week after I switched my pillow, for the last week and a half, zero issues, zero symptoms. And this was something that was coming up on a daily basis, which is now no longer present. Right. So it's just like, do we need to really go down the rabbit hole of how can I breathe better? How can I improve my posture? Or, do we switch the pillow? And for me, it's looking first for the pillow type solutions rather than the breathing type solutions, that I think most people will get the most amount of long-term return on investment from. So that just kind of as a general, or as a specific anecdote to maybe illustrate a more general concept I thought might be helpful. And if you have anything to add, drop it in.
Yeah, I mean that stuff comes up all the time. I had an assessment this week with a guy, who's been dealing with really, really severe back pain and nerve pain down, front, back, inside of his legs, and he was planning to get surgery. So I saw him this week for the first time. We'll see how this all goes, but the first part of the assessment was just like, let's go to a coffee shop that I know is just like a comfortable place where we can talk. They got, good seating. And, this is going to be the first, person out of the dozen or so people he's seen that really get to understand his story, which I think is, kind of one of the most important things, both from like a social and psychological perspective, but also just understanding like what are the triggers and what are the impediments in this person's life. And he'll tell you like, oh, I have worse pain in the morning. It tends to get a little bit better as I get up and walk around throughout the day. The last few times I've broken into debilitating pain, I was lifting things. If I when I met him, I saw the way he was sitting in the chair. I saw the way he got up from the chair. And to your point about sleeping, like one of the things we talked about is I asked him, well, what's your bed like? He's like, well, I have, a Tempur-Pedic mattress, so really like sink into that deeply. And I tend to like surround myself with pillows on the mattress. So he's got pillows on either side. So basically like he's like a board, he has this soft mattress where he's sinking in, but if he is to like, move out of that position, he may break into pain as well. And, like I mentioned about those big three exercises, one of the things that Stu talks about that you won't see on an MRI because it's not a moving picture, it's just like a, snapshot in time, is you can't see what's happening in terms of the disc as people, you know, are moving through different postures under different loads. So when you use something like an X-ray fluoroscopy, where you can actually see moving in real time, you actually see some of what he calls spinal instability, which is just basically like a slipping of the vertebrae, which you can actually kind of shore up with just adding a little bit of muscular stiffness. So that was a big part of where I would experience pain is people will describe things like when I roll over in bed, I break into pain. When I reach for something, I break into pain, and the pain acutely lasts for maybe a few days or so and then gets better. But I get these sharp pains from seemingly benign little movements, and then I'm just locked up for days. And they'll often say like, if I go for a walk, it makes it better. They will often say like, I sleep with like, this behind me, and like I sort of just fix, I build like a fortress of pillows, around myself, so that I don't move. Um, and sometimes even with exercise, we'll feel better because you're just adding a little bit of stiffness. If I do something that is twisting me a little too much, and then the next day I'm like, oh, I feel kind of tight, in my QL area. It used to be in the past I'd kind of stretch that out, try to get rid of it, but now it's like, oh, thanks for the reminder. Like what I did yesterday, maybe in last thing I could think of was like the elliptical. It's like, well, the past few times I did the elliptical, I get this kind of like QL tightness. In the past, it would have been like, oh, let's use some manual therapy to get rid of it. And now it's like, oh, thanks. That's not a good
Mhm.
idea. Let's go back to this stair stepper that I was using. But then I would find also when I trained back the next day, it would go away because I would just brace, really hard when I was doing rows. Now, I know I'm going a little bit of a tangent here, but I'm just coming back to also that whole big three concept of the reason that wouldn't have worked for me before when I had that kind of stiffness and was in a lot of acute pain is because just the compressive load from contracting my muscles that hard on a back day, if say I was doing a chest supported row, would also break me into pain. So early on in the process, it's really helpful to have things that add that degree of stiffness that kind of shore up those micro movements. Stu will describe it sometimes as like, one of the progressive things that tends to happen with our population is just like a flattening of the discs, and they without the stiffness they lose a little bit of turgor, like they're a little unstable. So it's almost like having kind of a letting a little air out of a car tire, and now you just lose a little bit of stability on the road. So he's just using muscular stiffness to sort of make up for that. But whenever you add muscular stiffness, you also add compressive load. And if a person is brought into pain from the addition of compressive load, that's problematic. So the idea with the big three is just to like have the minimal amount of compressive load with the most amount of stability. Now, maybe I could just with my behaviors at this point in terms of my training, activities of daily living, maybe I'd be fine, without doing those exercises. I don't know. But like I said, the investment is so small. I do tend to feel good, after doing them. That, yeah, it sounds a little bit like that rhetoric, of the corrective exercise thing. But keep in mind, like, I'm also changing the other behaviors, not just adding that one thing and expect to fix anything. Anyway, coming back to the guy, full circle here. You had mentioned your pillow, and for him, one of the things I mentioned to him was the mattress. If you're someone, when I walk up to him and he's sitting in his seat, with his spine really flexed and hunched over, and when he goes to get up, you can just see like the agony in his face coming out of that position, and he's describing trying to set up his bed in a way that adds a little bit of stability and stiffness, so to speak, externally, almost like this idea of anchoring or restraints. Maybe a bed that didn't necessarily, contort him as he was sleeping, would be a little bit better option. Because when we do exercises that add a little bit of stiffness, or we do, put him in postures that add that as well, whether we going to pick something up or tie his shoes, etc., it seems to feel better. So that's just another example, like of a lifestyle approach that really comes to my mind, when I'm seeing someone in that position.
Yeah, and I think that the more that you, I think the deeper that you go down this kind of journey, and you end up coming out the other end, it actually just it feels a lot more empowering to maybe observe specific things in your exercises that maybe previously hurt but now don't, and you look at it through the lens of like, I became sort of more empowered through the knowledge and just through the ability to navigate. And when you stop relying on or attempting to rely on quick fix solutions, like I said, you do develop those skills, and those skills, because they're principle based, apply across context. So whether it's your QL that feels tight when you wake up or your neck, right? It all comes back to, I think, the more general principles that you can apply, again, rather than just, what is sort of like the exercise equivalent of a soundbite, right? On social media or something. So I think that's a good place to wrap up there. Next week we will talk about who knows what, because we don't have a plan for next week. But I'm sure we'll find a good topic to talk about.